My name is Sanjeev Arora, and I serve as the director of the Echo Institute at the University of New Mexico. I'm a gastroenterologist by profession. 17 years ago, I launched this project called Project Echo. So the challenge I was having was that I was treating hepatitis C, and hundreds of people were dying every year because of lack of treatment, and there were no specialists in rural areas to treat them. So I started Echo with the idea of bringing excellent healthcare for hepatitis C to everyone in New Mexico. And we created this model which is based on technology to leverage the expertise of the university experts, one-to-many video conferencing. And we went around the state and set up new centers for treating hepatitis C. So I set up this idea of what we call case-based learning or iterative guided practice. And all 21 of these new centers would join me every week for a couple of hours on an interactive video session and present cases to me and to experts at the university. And over the course of a year, they became great experts. This was so successful. And first they treated their own patients, then everybody in the town started going to them, and many lives were saved, and we treated thousands of patients. But at that point, we realized that we could use this model for any number of diseases. Soon afterwards, we developed this goal to help 1 billion people by 2025. We needed to try and help every underserved patient in the world. And to do that, we started training other universities to do the Echo. Currently, we have about 400 academic hubs in the world connected to 25,000 organizations in 158 countries. And hundreds of thousands of doctors have been trained, and nurses have been trained, and community health workers have been trained. So for a very long time, we knew that the Echo model could be used for a rapid response to a pandemic because we already had our entire network set up. And then, of course, COVID-19 came along and the whole world changed.
Good morning. I want to thank Dr. Arora and his team for hosting me. It's a very impressive platform with great global reach. I love the fact that it's being translated in multiple languages.
There are more than 50 new publications coming out every day on new insights in COVID-19. So what our experts do at the University of New Mexico, they assimilate and synthesize that information. And then when these patients are presented from the rural areas of New Mexico, our experts help those people manage that patient. But through that management of that patient, everybody else learns in different parts of New Mexico. They learn from each other. And at the same time, our experts understand what are the key problems our healthcare professionals are having in the field. And in this endeavor, we partnered with the Department of Health in the executive branch. We partnered with the Human Services Department, HSD. We partnered with Tricor Laboratories, partnered with the Indian Health Service because the epidemic is so present in the tribal areas of New Mexico. And these are ongoing trainings, and they've been extraordinarily successful. Once we realized that we could use Echo for this, we have now scaled this effort globally. And overall, globally, we have trained more than 500,000 healthcare professionals in the COVID-19 response, and training thousands more every single day to save as many lives as possible.